Good morning, everyone. We are live here on the Newton Chamber Facebook page with David Kent, CEO at Piedmont Newton, and Dr. Norris Little, Chief Medical Officer at Piedmont Newton. And Merry Christmas Eve, everyone. We just wanted to come on and give everybody an update of, I know most people know we have a new variant out of COVID, and just kind of see what things are looking out like right here in Newton County as we are going into the holidays. So, David, I'm going to turn it over to you to let you start, and then we'll pass it on to Dr. Little.
Yeah, great. Well, thanks. Good to be with you, Debbie. And I wish everybody a Merry Christmas and Happy Holidays. First of all, hope everyone stays safe. Yeah, you mentioned the Omicron variant, and I'll let Dr. Little talk a lot more about this. But you read in the national news that cases are spiking up. And that, unfortunately, is also the case here in Newton County. We are seeing really over the last 4 or 5 days just a dramatic increase in numbers of patients coming into our emergency departments, entire families coming into our emergency department, needing testing because they've got COVID symptoms. And right now, the positivity rate for our area is over 10%. So of all the tests we're giving and others are giving, over 10% of those tests come back positive, which is quite a bit higher than it has been certainly through the months of October and November and even early December. During that time, rates were really pretty low, but we can't prove it. But we believe that this is almost all Omicron, that, we kind of got hit with the Delta surge in August and September, and really toward the back half of September, that wave started to go down and really has been fairly low and steady. So just our hospitalization rate with Delta has not been very high. And then bang, all of a sudden this last week, something has changed, and we believe that something is Omicron. And so the good news is, so far, as much as activity as we're seeing in our emergency department, and I know I track what's going on in the urgent cares as well, it hasn't led to a tremendous number of COVID admissions to the hospital yet. Our admissions are up. They've doubled really in about a week. But we were at a very low number to begin with. So, it'll be interesting to see over the next couple of weeks how many of those patients translate into actual hospital stays. The challenge we're facing right now at the hospital is we're full with other non-COVID patients as well. So that's really starting to put pressure on our operations. If you go to our emergency department right now, there'll be a lot of people in there and you'll wait, hopefully not too long, but then that's because we're holding in patients in our emergency department right now. And we're not unique in that way. Most of my colleagues around the Piedmont system report a similar situation. And then the relationships and what I read locally across Atlanta, that is true, not in every case, but in most cases. So it's not unique to Newton per se. It's really everywhere in Georgia. And, the thing we know about Omicron so far is that it is very contagious. So, it's a little bit of the timing of it is bad news because it's right at the Christmas holiday and people are getting together, and, we know that we're not going to be able to stop that. Because people want to get together over the holidays, of course. So that, that's the bad news. The good news is that kids aren't in school right now, which I think, kind of works in our favor a little bit. And I was talking to Dr. Fury about that the other day, that, maybe a blessing that it hit right over the Christmas holidays. So, but nobody really wants to be sick over Christmas. We certainly at the hospital don't want to be stressed and stretched over the holiday, but that's the situation that we're in. And we're going to rise up and take care of the patients that come to see us. So that's a little bit about what's going on at the hospital. Dr. Little, why don't you just, fill in anything I may have missed, but then also talk a little bit more about Omicron and, what we know, and, let's say what we know. And then, if people want to know what we think, we can tell them that too, but we need to make sure we tell them that's what we think, not what we know. So over to you, sir.
Certainly. And I agree with David. I feel very, very confident. I mean, we know factually that Omicron went from 5 to 50% to 75% of cases in the U.S. over about a 2-week period of time. So I think certainly, we can be very confident that that what we're seeing right now is a surge in COVID cases related to the Omicron variant, which is very, very contagious. There are some, there are some other things to say about Omicron. Some of the studies, this is a little esoteric, but it looks like this particular virus tends to replicate more in the upper airway instead of the lower airway, which is a good thing. That doesn't mean it can't cause severe disease, but maybe it's a little less frequent. There was a report out of South Africa and Scotland that was published recently that looks like the hospitalization rate with this particular variant is lower than with previous variants. Now, that could be because of the vaccinations that people have received and because of people's previous exposure to COVID. So all of those occur. And this particular variant, though, has a very high breakthrough rate, probably 5 times greater than Delta. So we are seeing people that have been vaccinated and who have had COVID get the Omicron variant. But the disease is likely to be milder and mild in those individuals. So, but as David said, this variant is orders of magnitude greater in terms of its ability to spread. I think the options currently are you can get COVID vaccinated or you can get it unvaccinated. But I think it's going to be hard for people to avoid it altogether. But we're certainly hoping that it will be less severe and fewer hospitalizations. The other concerning part about this is that the monoclonal antibody therapy does not appear to be effective against this variant. So I know I read yesterday that the New York hospitals are considering discontinuing the Regeneron monoclonal antibody therapy. I suspect within the next several days there'll be guidance from the CDC around that. We'll just have to see what they say. The only other monoclonal antibody that is effective for Omicron is not widely available. In fact, there are very limited quantities of it. So that's a concern. And the FDA just today issued emergency use authorization of an oral medication called Paxlovid, which is a Pfizer product. It's 2 different medications that you take together. Should be started, the recommendation, within 3 days of onset of symptoms in people that are high risk. So that what I don't know, though, is how quickly they'll be able to ramp up the manufacturing of that product. So we don't know its availability yet, but that just occurred today or yesterday. So, we certainly, I think our, concern is just keeping our workforce well. That's I think that's for the hospital, not overly concerned about people our workforce is largely vaccinated. But if they get this, it means they're out of work. And if it's that easily transmissible, it can mean large numbers of people are absent from work, which can certainly affect our ability to provide care. So our focus right now is really, trying to keep our, workforce healthy and well. And, but happy to answer any specific questions around. Oh, one other thing, the COVID vaccination. So the booster certainly does have effectiveness, especially the Moderna booster, but also Pfizer in prevention of the Omicron variant and prevention of severe disease. So the booster is effective, and we certainly recommend that for folks in terms of helping to prevent moderate to severe disease from the Omicron variant. So I think those are the key things that I would have to say about it.
Dr. Little, it looks like we have a comment our question was asking if we're able to identify the new virus in lab work, or are we just going by different symptoms?
So the variants are not, the identification of variants is only performed in research labs and by the CDC. That's been true throughout the entire pandemic. The COVID tests that hospitals run, that you get at the pharmacies, that you get, the over-the-counter ones, none of those identify variants. So that's a misunderstanding that people have sometimes, that we can identify that. So and the symptoms, you really can't make a determination. We really have to go by the reports of prevalence that we get from the CDC regarding the penetration of variants in the communities.
Great, thank you. I think we have another question on here. They've read reports that say that they predict that we are well on our way of dealing with COVID, much like the flu virus. In your opinion, do any of these reports hold any weight?
Well, those reports are opinions, and they're opinions by, people that are experts or that have, experience and expertise, but they're still opinions. So we don't have, data, but so my opinion would be similar, though. I mean, I think that, if Omicron is going to be widely spread throughout our society, then there's a good chance that that's going to get us to a couple of things: more of a herd immunity to COVID, and also that subsequent, versions of COVID will have, will be less, will have lower spread and lower severity, because there will be so much immunity within the community. So in that respect, I would tend to agree with that, but I would say that's my opinion. It's not it's not something I can say that we have data to support yet.
Great, thank you. One more just came in. How strong is the Omicron variant?
I'm not sure, what they mean by strong. I think that it's, as we said, it's highly contagious, more contagious than any variant we've seen, and probably several times more contagious than Delta, which was a very, very contagious virus, or variant. If they're concerned about how likely is it to cause severe disease, and moderate to severe disease and hospitalization, there's some early evidence to suggest that it may not be as severe as previous versions, but we don't know that for sure. So if I'm a high risk person, if I have risk factors, either age or diabetes or high blood pressure, obesity, all those things, then I would not depend upon that to protect. I would want to get a booster and protect myself, because I just wouldn't, I think we don't know the answer to that yet.
Right.
Don't you think, Dr. Little, we'll have a much better sense of that here in a couple of weeks as we continue to see more and more cases present? Typically, hospitalizations and ICU stays and ventilator usage, and unfortunately death follow people getting it by a couple of weeks. So I think we'll be a lot smarter about how difficult this particular variant is. By the middle of January.
Right.
Great. I've got a question. I know when Delta kind of surged, there was a lot of difficulty in finding testing, and I see a lot more testing availability, but I'm also seeing and hearing the use of the home test. So are those as accurate as getting tested, or what are your thoughts on that?
So I know a lot of people that use a home test, and if you do a home test and it's positive, then it's likely accurate. So most of them have a specificity that's in the 95% range. The over-the-counter or rapid test, if you want to call it rapid tests. The problem is on the sensitivity side. So if you're symptomatic and you do a home test and it's negative, then that I would not trust because they're only about 70% sensitive. So that means they're going to miss 3 of 10. So I think that now they're testing, sites. The public health department still has their testing site available at Springfield Baptist. So, and that location, they're still operating that, and we would encourage the use of that as a testing site. If you did a home test and it was negative and you still were concerned, then I would get additional testing through a PCR-based test of some kind and or molecular test. So, but if I know people certainly that have done home tests and they come back positive, they have symptoms, I would say that that's an accurate test to say that they do have COVID.
Okay. Looks like we had a question come in around that. If you have no symptoms but were exposed, can you still trust a negative home test?
No. and I would people ask me when to test, and generally we recommend if somebody doesn't have any symptoms and they've been exposed to test around day 4 or 5. Okay. If you test too early, you may not show up. So if I'm exposed on, last Sunday, then, Monday, Tuesday, Wednesday, Thursday, or Friday to get a test to, and I would want it, if I'm going to get that kind of a test, I would probably recommend a molecular test of some kind.
Dr. Little, aren't we also seeing that that people are presenting with symptoms sooner after exposure than previous variants?
Yes, I think the average incubation time for the Omicron seems to be about 3 days, and the other, but when I say average, it could be 1 day, and it could be 4 or 5 days. So, but the average is about 3 days, which is a little shorter than with some of the previous variants that we've had.
Which in some ways, I think that's good news as we try to manage this.
It is.
The sooner people know they have it, the sooner they start to behave in a way that protects others.
Yes. Well, I don't have any other questions that have come in. I think I'll take this time to say that we can all agree on there's still a need to get vaccinations. I'm not sure what percentage we are, but I know with the spread that I'm hearing, we do need to get vaccinations and get boosters. And vaccinations you see are readily available around our communities. So if anyone has questions on that, please send us a message on Facebook, and we'll get you that information out as well. Do you guys have anything to add before
On
we
the
wrap?
just on the vaccination, so if you had, it doesn't matter which booster you get, which,
Okay.
so if you had Moderna, you can get a Pfizer booster. If you had Pfizer, you can get a Moderna booster.
Okay.
It doesn't matter. So,
Good to know.
Yeah, I would just say I'd like to just publicly here say thanks so much to our team back at the hospital who, really the last thing I think anybody wants in our society is another COVID wave. And certainly our staff at the hospital doesn't want to see another COVID wave, and definitely not right at Christmas. But we're here, and we're partnering with each other, and we're sticking together, and we're going to get through it, and we're going to take care of our community along the way, and it'll be our privilege to do so. But it won't be easy. And so I just want to give a shout out to our entire team and our entire medical staff. Obviously, Dr. Little's our CMO, but our physicians have been through it. Our nurses have been through it. Our respiratory therapists, our LPNs, our CT techs, our MRI tech. I mean, everybody at the hospital has been through it, and yet we're still standing and we're still fighting. So I just want to say thank you to them. And, they really have been, people have called us heroes early on. And, and that first wave was really it was a big deal if you got COVID, and certainly had bad COVID, but in terms of numbers, it wasn't bad on the healthcare system. But really, since the second wave, everyone has been heroes. And I've got story after story about people who have stepped up and worked harder, worked longer. And I just could not be more appreciative. And I'm so fortunate to get to work with those folks, and we're fortunate to get to serve our community. So I wanted to say that. Thanks.
Yes. We have another question, but I would like to piggyback on that too, David. As a citizen and representative of the business community, thank you and the team there at Piedmont Newton for all you've done over the past 2 years. We definitely appreciate it and feel the hard work that you've done. So we do have one more question. Are you seeing any different symptoms with Omicron?
The reports are that the Omicron may cause more upper respiratory symptoms like scratchy throat and nasal congestion, but I don't, that's a very, that you can see that with any of the variants, but it seems to have more of that, but that can, be true with a common cold as well. So it's very hard to say, but nothing else new. I want to mention one other group that concerns me, that there's a lot of misinformation about that. And I want, it would be helpful for the public to know the issue around pregnancy and COVID. We have seen at our hospital and nationally, the first reports I read about this were in Birmingham, that women in their third trimester of pregnancy getting severe COVID and basically dying from COVID. And I just, the vaccine, we've not seen any effects on the unborn child from the vaccine. And we have seen even here really severe COVID in third trimester pregnancy that has been devastating. So we would want people to understand that in that setting that the vaccine is safe. We encourage the vaccine in pregnancy because of the increased risks that it poses to the mother during that time. So that's just a kind of a public service announcement and encouragement for people to consider that.
No, I think that's important information to get out, because that's where we've heard a lot of concerns and around COVID and the vaccine. So thank you for adding that in, Dr. Little. With that, I think we will wrap this up for today. And if you're catching this after the live broadcast, please feel free to type in a question and I can pass it along to Dr. Little and David Kent. And we hope everyone has a very Merry Christmas, Happy Holidays, and a Happy New Year. Thanks, guys.
Absolutely.
Thank you.
Merry Christmas, everyone.
Merry Christmas.
Bye.
Bye-bye.